Proteus, Providencia, Morganella. These are gram-negative rods that are present within your GIT tract, specifically in the colon. These three organisms cause one disease, that is UTI. Now, UTI can be caused in both community acquired as well as hospital acquired. Now, previously given a few historical notes about this, Providencia and Morganella were part of this genus Proteus, but later on, due to some biochemical test differentiation and certain cell wall antigen differentiation, this species were given its separate group. Now, going towards this organism, it is a gram-negative rod actually that consists upon two enzymes. They secrete two enzymes. The first enzyme is phenylalanine deaminase, which is specifically used for its identification, and the other enzyme it secretes is urease. Now, this converts urea into ammonia and carbon dioxide. These organisms are very motile. They produce a swarming-like effect whenever they are present in blood agar, meaning producing waves in that. So meaning that you need to first stabilize it by specific use of alcohol so it does not cause swarming movement, and you're able to identify it. Another thing is that it has a surface O antigen. Now, surface O antigen is it helps in diagnosing of certain diseases. Now, this cell wall O antigen is used in real Felix test that helps to identify rickettsial antibodies in a serum. So, this organism itself is helped in using, or its antigen is actually taken in order to diagnose other diseases such as rickettsial antibodies. So this type of test is known as real Felix test. Now, going towards pathogenesis, we know that this organism is present in the colon. Now, how? From the colon it goes to the bladder and causes UTI. Now, whenever this is excreted slowly with feces, when you do not properly clean yourself, what happens is, normally in women, because their urethra is quite small, by not properly rubbing your bottom clean properly, so this organism from the colon or from the rectum or from the anus go towards your bladder. Now, they infect your urethra, causing urethritis like symptoms, and they can similarly ascend in bladder. If the infection is a lot, they can even go up to your kidneys and cause pyelonephritis. But at the same time, how does this organism survive in the bladder? Because it is urease positive, so it converts all the urea which is present in the urine to ammonia and carbon dioxide, making the urine more alkaline. So this favors more bacterial infection, and similarly, as the bacterial infection progresses towards the kidney, they result in formation of Struveroid stones. Now, Struveroid stones are specific stones which consist upon magnesium, ammonium, and phosphates. Now, the clinical finding of all of these organisms, which results in UTI, and sometimes it can even cause pneumonia and sepsis if this disseminates into the blood. Other types, how do we differentiate it? We differentiate it by growing this organism on a blood agar which has a swarming-like effect, but as I've told you, we have to inhibit its motility in order to identify the organism. So we use phenylethyl alcohol in order to stop its movement. Apart from that, we can do a TSI test which helps to differentiate between these three organisms, because we know that is a gram-negative rod and it could be either Proteus, Providencia, or Morganella. So what we do is, in order to identify which specifically this organism is resulting into, we do a TSI test. Now, as I've mentioned, Proteus contained actually the genus Morganella and Providencia previously. Its initial names were P. morgani before it turned into Morganella, and P. retigri before it turned into Providencia. Now, by using biochemical tests, we can differentiate it into further genuses groups. Apart from that, few other organisms of Proteus are P. vulgaris and P. mirabilis. Now, in order to differentiate which is which or what type of organism is actually causing that UTI, what we do is we do an TSI test. Now, TSI test, what happens is you can find acidic parts in both of P. mirabilis or P. vulgaris, which is differentiated a high grade Proteus, and both of these organisms produce H2S gas, whereas Providencia and Morganelli do not give acidic parts or H2S gas on this test. Whereas what we can see is, in order to differentiate between the two, we can do indole test. Now, indole test is positive by P. vulgaris, by P. registri, which is Providencia, and P. morgani, which is Morganella, but it is negative by indole, so by P. mirabilis. Now, so similarly, we can differentiate between P. vulgaris and P. mirabilis by indole test. All of the rest of the organisms are indole positives except for this, and the only two organisms which provides an acidic part is P. vulgaris and mirabilis. Similarly, Providencia and Morganella can be ruled out by this TSI test. Now, how do we treat this organism? If you have Providencia, this organism is mostly resistant and you will need a lot of antibiotics to overcome it. But if it is Morganella, you only need cephalosporins, whereas P. vulgaris also needs cephalosporin, whereas P. mirabilis, which is indole negative, is responsive to ampicillin. After doing the TSI test, we can also know that this organism is a lactose non-fermenter. So if it is cultured, this organism would give colorless colonies on McConkey. And another treatment that is given to all of these organisms in combination, and in order to overcome this resistance, if any of it is created, we give the patient aminoglycosides and trimethoprim sulfamethoxazole.